This video will cover clear cell renal cell carcinoma, the most common renal cell carcinoma in adults. To anchor ourselves, let's begin by noticing a few things. The first is this clear airport security machine. The next thing to notice is the character who is being screened here, and it's a crab. Isn't crab a universal sign for cancer or carcinoma? Putting these two together, we will remember that this video refers to clear cell renal cell carcinoma. Let's move on. Maybe this machine is incredibly expensive because look at this fence keeping it safe in place. This fence looks kind of like chicken wire, doesn't it? Well, it represents the fact that these tumors have vascularity that looks a lot like chicken wire. Next, let's talk about some molecular. These tumors are usually sporadic, but they are also associated with biallelic VHL inactivation and von Hippel-Lindau syndrome. To represent this, we have two stuffed animal hippos. Hippo will remind us of the von Hippel-Lindau portion. The fact that there are two of them will remind us of biallelic, and since these are stuffed animals that are not living beings and are therefore inactive, we can remember inactivation. When these tumors are associated with von Hippel-Lindau syndrome, these patients have been reported to also develop other tumors. Let's talk about these. The first one is hemangioblastoma, which is represented by our character here. I'll admit, this cartoon was before my time, but I've always heard about it. If you don't know, this guy's name is He-Man, and he will represent hemangioblastoma. The next tumor associated is pheochromocytoma. Whoa, this machine really is futuristic because look, it's even asking the person who is being tested a question. It's asking, can you feel it? And of course, since feel sounds like pheo, that's how we'll remember pheochromocytomas. Next, pancreatic serous cystadenomas. These are represented by this searing pan, because searing pan sounds like pancreatic serous. Lastly, endolymphatic sac tumors. If you don't know, these are tumors that arise in the endolymphatic sac, which is a small pouch located in the inner ear. This is represented by these very prominent ears on our main character. One of the important characteristics of these tumors is that they metastasize hematogenously and are known for late metastasis to odd places in the body. The hematogenous spread is represented by this bucket of red paint. Additionally, our He-Man character will also represent the fact that metastasis tends to happen through the renal sinus veins. The renal sinus veins will be represented by this rope that he's holding here that is next to the bucket of paint. Moving on to diagnostics. These tumors characteristically stain with a diffuse and membranous pattern with CA9. If you notice, the manufacturer of this machine is called CA9, conveniently. And there is a sign above the machine that says diffuse and membranous. Oh, and one last important point. Grossly, these tumors are commonly yellow with frequent hemorrhage and necrosis. The hemorrhage and necrosis are easy to remember because we know that these tumors have this chicken wire prominent vasculature bringing in lots of blood. And where there is vascular congestion, there likely is necrosis. The yellow color can be remembered by this nice golden yellow hair on our character here.